We've all heard it before, don't step on a rusty nail, or you'll get tetanus, but how many of us have really thought about what that actually means? What really happens inside your body after you step on a rusty nail? The moment you feel that sharp pain shoot through your foot, something much more dangerous has already begun, and that's what we're about to explore in this video. It's not just about the rust, it's about a deadly bacteria lurking in the shadows, waiting for an opportunity to invade your body.
Click subscribe to this channel to get more topics you love.
When you first step on a rusty nail, the puncture wound might seem small, maybe it barely bleeds. It's easy to brush it off and think, I'll clean it later, but what you don't see is what makes it so dangerous. That nail, sitting out in the elements, likely picked up tetanus bacteria, which thrives in places like soil, dust, and rusty metal. And the worst part, it's not the rust itself that's the problem, it's the perfect environment for Clostridium tetani, the bacteria responsible for tetanus, to grow. As soon as the nail breaks your skin, the bacteria have an entry point. They get inside your body, and because they're anaerobic bacteria, they don't need oxygen to survive. In fact, they thrive in low oxygen environments like a puncture wound, deep inside your tissue where air can't reach. Once inside, the bacteria begin multiplying, and they start producing a powerful toxin called tetanospasmin. This toxin is what causes all the trouble, and it's extremely potent. Let's pause here for a second and ask, what would you do if you were in this situation? Would you brush it off and go on with your day? Or would you take immediate action? Most of us probably wouldn't think twice unless the wound looked bad. But here's where things start getting serious. That toxin is slowly spreading through your body, and once it gets into your bloodstream, it heads straight for your nervous system. So the nail has punctured your skin, and the bacteria are already making their way through your body. You may not feel anything unusual at first, maybe just a bit of soreness around the wound, but beneath the surface, things are getting dangerous. As the tetanus bacteria multiply, they release a toxin called tetanospasmin. This toxin is incredibly powerful, and its target, your nervous system. Once tetanospasmin enters your bloodstream, it begins to travel through your body. It's designed to disrupt the signals between your nerves and your muscles. The first thing it does is bind to your nerve endings, preventing important chemical signals from passing through. In simple terms, your muscles lose control, but not in the way you'd expect. Instead of going limp, they go into a state of constant contraction. Think about that for a second, muscles that never stop contracting. The first signs of tetanus usually show up as stiffness or tightness, especially around the jaw, which is why the condition is often called lockjaw. Imagine trying to open your mouth and realizing you can't. Your jaw muscles have locked up completely. It's terrifying, right? But that's just the beginning. The toxin starts to spread to other parts of your body, causing muscle spasms that are not only painful but uncontrollable. These spasms can affect your entire body. It starts in the jaw but quickly spreads to the neck, back, and limbs. The muscle contractions are so severe that they can actually cause your back to arch, a condition known as opisthatonos. You might even experience spasms in your diaphragm, the muscle responsible for helping you breathe. This is where things get really dangerous, because when your diaphragm is in a constant state of contraction, it becomes nearly impossible to breathe. Now imagine yourself in this situation. Your muscles are spasming uncontrollably. You're struggling to breathe, and there's nothing you can do to stop it. At this point, the tetanus toxin is wreaking havoc throughout your body, and the worst part is that there's no quick fix. Tetanus isn't like a common infection where you can take an antibiotic and feel better in a few days. It takes time, weeks, or even months to recover, even with proper treatment. So here's a deep question for you. How well do we really understand the risks we take when we brush off small injuries? A tiny puncture wound from a rusty nail, something that seems so minor, can lead to something life-threatening. Yet many people ignore it, thinking it's not a big deal. At this point, the toxin from the rusty nail has taken over your body, causing muscle spasms, stiffness, and in severe cases, even difficulty breathing. The question now becomes, can you survive tetanus? The short answer is yes. With medical intervention, survival is possible, but the path to recovery is long and grueling. Once you're diagnosed with tetanus, the first step in treatment is to neutralize the toxin that's already in your system. Doctors will administer an antitoxin called tetanus immune globulin TIG, which helps to stop the toxin from doing further damage. But here's the catch: while the antitoxin can prevent the situation from getting worse, it can't reverse the effects of the toxin that has already bound to your nerves. That means your recovery will depend on your body's ability to regenerate those damaged nerve endings, a process that can take weeks or even months. During this time, you'll likely be given medications to control muscle spasms and keep your breathing stable. In severe cases, you may need mechanical ventilation to help you breathe, especially if your diaphragm muscles have been affected. Patients with severe tetanus often require intensive care to manage complications, and even with treatment, the muscle stiffness can take a long time to subside. The body can recover, but tetanus is not something to underestimate. The recovery process can be slow and painful, requiring physical therapy to regain full muscle function. And in some cases, the damage can be permanent, leaving lasting effects on muscle control. But here's the key point: tetanus is preventable. That's right, with a simple tetanus vaccine, you can protect yourself from this life-threatening condition. Most people receive tetanus shots as part of routine childhood vaccinations, and booster shots are recommended every 10 years. The vaccine works by stimulating your immune system to produce antibodies that can fight off the tetanus toxin before it ever has a chance to spread. So, why do people still get tetanus? Often it's because they aren't up to date on their vaccinations, or they don't realize how quickly tetanus can set in after an injury. This brings us to a crucial piece of advice. If you ever step on a rusty nail or get a deep puncture wound, seek medical help right away. Even if the wound seems minor, you need to clean it thoroughly and get a tetanus booster if you're not up to date. Let's stop for a moment and reflect on this. How many times have we ignored small injuries, thinking they wouldn't lead to anything serious? Stepping on a rusty nail, getting a deep cut, these things happen all the time, but we rarely consider the potential consequences. Tetanus is a reminder that even the smallest injuries can have dangerous outcomes if left untreated. The next time you're faced with a similar situation, ask yourself, are you willing to take that risk, or will you take the steps to protect your health? This isn't just about surviving tetanus, it's about understanding the importance of prevention and recognizing that our bodies are vulnerable in ways we don't always consider. So let's conclude with one final thought when it comes to your health. Don't wait until it's too late. A tiny wound may seem insignificant, but what happens inside your body after stepping on a rusty nail is anything but minor. Take action early, protect yourself, and stay aware of the risks. After all, your life could depend on it.